afternoon, everyone, and welcome to our discussion with the Department of Children and Families and Prevent Child Abuse New Jersey on preserving connections and preventing child abuse during COVID-19. We're very excited to offer this webinar today. The reason for the webinar is our concern about the impact of COVID-19 and social distancing on vulnerable children and families. This is a time of high stress for families and potential isolation that could put additional stress on families. At the same time, it's also that time that those people who interact with children and families, like teachers, childcare staff, are not there in person to really see what's going on with children and to offer help. April is also Child Abuse Prevention Month, so it's a great time to talk about what we can do to support families during this crisis in two ways. One, formally, in terms of those services that can help. And I think it's very interesting, and you'll hear today about how the department has adapted services that are provided now remotely, and also informally, what we can all do as individuals to protect children. I know this is a priority of Commissioner Christine Beyer from the Department of Children and Families, who has led both formal and informal policies to support families and protect children. I am thrilled that she can join us here today. She'll be followed by Janira Hill and Lenore Scott, both from the DCF Office of Family and Community Partnerships, to talk about some programs that can help and how they're adapting during this time. And then Gina Hernandez from Prevent Child Abuse will be here to talk about strategies that we can all do as individuals, as members of the community, to step in and help. Just a couple of logistics about the call before I turn it over to Commissioner Beyer, and ask you all to keep your phones on mute. Presentations, we'll hear from the speakers first and then have time at the end for wrap-up questions. If you have questions, please put them in the Q&A box. We will monitor, group those questions and raise them with the panelists at the end. I know people have been using the chat function, but that's not going to be monitored during the call. So please, again, any questions, please put them in the Q&A. And each of our presenters will have about 10 minutes to present, so we're leaving an opportunity for questions at the end. So let me formally introduce Commissioner Christine Norbert Beyer. We're thrilled to have you join us today to start our discussion, and she'll be followed by Lenore, Janira, and Gina will do the wrap-up. Thank you.
I really want to just start out thanking SEAL and our friends at ACNJ for co-hosting today's webinar on preventing child abuse and neglect during the COVID-19 pandemic. As partners in prioritizing children's health and well-being, we've had several conversations during these last few weeks about how best to respond to the challenges that the novel coronavirus has presented for the families we want to protect and support. The face-to-face ways we use to connect with residents are not viable right now, and so we've been forced to get creative in our outreach, which has been stressful but also refreshing. I've been making a concerted effort to connect more regularly with providers, and I think it's helping us at the department to be more responsive and providing us with up-to-date insight into families' needs. When I became commissioner, my goal was to change the narrative about DCF. Historically, people associated us only with our child protection role, which is certainly an important one, but just one aspect of our work. Primarily, we are a family serving agency. Our vision is for all residents in New Jersey to be safe, healthy, and connected. Our work, therefore, is to prevent maltreatment, to preserve families, and to do what we can to help them thrive. During this historic and unprecedented healthcare crisis, the work of DCF and our partners throughout New Jersey, including ACNJ, has never been more vital. April is National Child Abuse Prevention Month, but as we struggle to flatten the curve and reduce the spread of COVID-19, we know that social distancing brings with it challenges in keeping children safe from abuse and neglect. We know that families and children who were struggling before may become even more vulnerable during this time of elevated stress and isolation. The research shows that during natural disasters or national emergencies, like what we're experiencing now, families are subjected to greater levels of heightened anxiety, while at the same time, parents and children are separated from their usual forms of support, like time with friends and family, school and community events, and routine healthcare visits. Increase in trauma coupled with a decrease in support like this can lead to an increase in maltreatment and family violence, including child abuse, neglect, and domestic violence. And we know that this kind of violence thrives in the dark, unseen, and underreported. As we look at the data across the country and really around the world, the impact of the COVID-19 pandemic on family safety is becoming clear. In New Jersey, as in other jurisdictions, we're seeing fewer referrals to hotlines and helplines. 1 year ago, in March 2019, there were 7,501 referrals made to the State Central Registry, which is, as you all know, our 24/7 child abuse and neglect hotline, for either child protective services or child welfare services. This year, in March 2020, there were 5,234 referrals. That's a 30% reduction. And March is traditionally one of our highest reporting months. And currently for April, we're tracking at about a 50% reduction over April 2019. This percentage is even more consistent with what other states have been reporting, with some reporting over a 70% drop-off in calls to their hotlines. And this reduction certainly doesn't mean that children are experiencing less abuse or neglect, but rather that it isn't being seen or heard, and so not being reported. And because it's not being reported, it's harder for us to connect families to supports and assistance. So we all need to do our part to bridge the gap, to connect with families that we know, to make sure they're staying strong in the face of adversity, and to spread the message that help is available if families need it. Not all families need crisis intervention. Some have material needs that are being unmet, or need access to online classes or therapeutic supports, or maybe they just need someone to vent to. As just one example of the type of work we're doing right now, I want to share with you a situation that one of our COVID-19 response team members recently managed. In Bergen County, where COVID-19 cases are most prevalent, a local police department contacted our regional response team with concerns for a 3-year-old. The house was in disarray, clothes and toys were strewn about, takeout food containers littered the counters, and dishes were piled up in the sink. There was broken glass on the second floor landing. The child lived in the house with her parents. Her mother had been diagnosed with pneumonia and was awaiting the test results to determine if she was positive for COVID-19. Her father had called 911 when his wife's health declined. Sadly, the mother passed away 2 days before the test results returned, confirming a positive diagnosis for COVID-19. And the father had tried to do everything he could to balance working from home, caring for his child, managing the house, and comforting his ailing wife. On the day she passed away, he was frantically running up and down the stairs to supply her with fresh blankets as her fever raged. He knocked over a picture frame explaining the broken glass in the stairwell. When our team reached out to Dad, he was nervous. His family had never been involved with DCF or DCPMP before, and he feared losing his daughter so soon after losing his wife. Our responder reassured him that she was only there to support him in whatever he needed in this difficult time for his family. And the father later told us that he will never forget the DCPMP team member's kind, calming voice and the reassurance and support she showed his family in their time of need. Our team member continues to stay in contact with the family to make sure that they have access to the services and supports that are available to keep them strong and help them work through their grief. Dad ended up testing positive for COVID-19 after his wife's passing and was in quarantine with his daughter, but was safely supported by family, friends, the community, therapeutic supports, and telehealth programs. And one of our own frontline heroes who embodies the best of what our department can be. Today, Dad and his daughter are both healthy and continue to be well supported. So while I'm unsurprised, but incredibly proud of the staff that coordinated and executed this helpful and sensitive response, this is not an outlier. This type of support and assistance is happening every day throughout the state. Before I wrap up, I also want to raise the issue of disparity. We're seeing very clearly on the news, on social media, in our own work experiences, how much of a struggle it is to live in poverty. This is not news for those of us working in social services, but the prevalence of businesses closing and low-wage jobs being eliminated has created a conscious awareness that didn't exist before for many people. The people impacted most by this are disproportionately people of color, hourly workers living paycheck to paycheck, living in unstable housing, with food insecurity, and with limited access to quality healthcare options. Much of this is a result of centuries-old institutional racism. What is so noticeable to us now, under the lens of COVID-19, are the challenges they've been faced with long before this pandemic started. DCF's Race Equity Steering Committee continues to deliberate on these issues and more so that when life returns to normal, or whatever normal will be, we can take our lessons learned and create strategies that empower and support our families of color. The next two speakers work in our Office of Family and Community Partnerships, which focuses on maltreatment prevention efforts. They'll talk about how we've pivoted our practice models to support telehealth, to engage in safe social distancing, and to continue to keep New Jersey's families safe, healthy, and connected. When they're done, please Google New Jersey DCF or NJDCF COVID-19 to visit our website and to get important information about our work during these unprecedented times. Be well and stay well. Thank you.
Hello, everyone. My name is Janera Hill, and I'm the administrator for the Office of Family Support Services in the Department of Children and Families. And I want to start off by saying thank you so much for this opportunity, ACNJ. Thank you so much, Commissioner Beyer, and thank you to my colleagues on this webinar. It's an honor to connect with everyone, over 300 participants viewing this webinar right now. The commissioner's slide before mine, her words on how COVID-19 impacts the vulnerable population, communities of color, her words speak directly to me, to my family, and I'm sure for a lot of us on this webinar viewing, to us as well. And if it doesn't speak to you directly, I'm sure that we can think of someone in our lives that it does connect to. I think about the programs that are in my office, the families that we support. Just as the commissioner said, the need was always great, but COVID-19 just magnifies it. We know how hard it is to be a part of a multi-generational family where you have a great-grandmother and a newborn and everyone in between living in a small, tight house. But then when you add in a family member that may have contracted COVID-19 and they're recovering, it's now hard to practice social distancing. Or that student that's now home and should be focusing on their remote learning, but they have to put that to the back burner because they've stepped into a new role of caregiver to their younger siblings. Their guardians or parents are still going out every day to go to work to keep our country and our state running, not because the first thought is that they're heroes, but because they have to continue to do this to survive and support their families. So they're putting their lives at risk, they're putting their families at risk when they come back home. And so our programs, we're seeing this every day. We've been seeing it, but now it's just magnified. And so I wanted to take the time to talk about the work that comes from my office. I want to be mindful that there's 300 plus participants, and not all of you will be providers, but that you may find yourself, you're a caregiver and you're viewing this just to become more knowledgeable about what's out there. And so I'll be thoughtful in my language and how I describe the programs, because what's most important is what the programs do, who are they for, and how do I get connected. Everyone speaking on this webinar, we're in the business of prevention. right? We're going upstream to meet the needs of families with children. And so if we think about a range, right, the spectrum, all of the programs in my office fall somewhere in between. On one end, it's universal. We want to make sure that families are connected, they have access to tangible things that keep their families together, and also how to access them themselves, increase their social network. Then as you move along, there are programs that are specific for a special need or a specific population, right? We think of substance abuse, mental health. So most of the family success centers I will talk about that's all in my slides today, but I just wanted to quickly touch base on some of our other programs. We have a school-based youth services program that's specifically for students. And so there are 150 programs throughout the state of New Jersey. No, they're not in every school district, but there's at least one in every county. And for schools that have that program, it's either in elementary, a middle school, or in high school, and it's a space that is dedicated for that student. And so now that has changed. Majority or all of the programs are working remotely. They are doing virtual individual counseling sessions, group sessions, and virtual hangouts for students. Because again, for those students that had a hardship at home, school was their refuge. So now they're being pulled away from those social connections, those people that really cared about them. And so our team in this program, School-Based Youth Services, there's a YDS, a youth development specialist that focuses on engaging and helping students navigate relationships, because on a good day, before COVID-19, it can be hard growing up. There's also a mental health clinician that works to do the individual and the group counseling. But I also want to think that this program is helping to make sure and ensure that the students are achieving educational success, but they're also building that foundation or the building blocks, life skills, so that as they transition, they already have that foundation to smoothly transition to adulthood. Think about the frontal lobe, where we make the executive decisions. At that stage in life, that area of the brain is not developed. So having the additional support for students is much needed. So they're doing the remote classes, they're doing the remote therapy sessions with students, and they're finding out, and we're learning in the office that districts are reaching out to those schools that have the program to take on more students outside of the schools that they're in, because the need is so great. Students are stressed, they're scared, they're fearful of the unknown. You may have a graduation and you don't even know if that's happening right now. Another program that we have is Kinship Navigator. This is a program for caregivers, an aunt, an uncle, a family friend that may find themselves taking on a role of caregiver to a child that's not theirs biologically. And so Kinship Navigator historically was really put in place for those grandparents taking on and caring for their grandchildren. So this was a resource specifically for them, those grandparents that find themselves parenting a second time around. There's 4 across the state, 1 in each region. There's 2 in northern part of New Jersey, 1 in the central and 1 in the south. And they help you to navigate the resources and to connect you to those supports so that families can stay united together. And also there's like a financial assistance program that goes with it. So there's some eligibility and income requirements for that. All of those programs are voluntary. You can come and go as you please. Lastly, Family Success Centers. As you can see in the picture, this program falls on the universal. It's for anyone. We want to make sure that everyone can get to what they need. In the previous picture, you can see that it's a home-like environment. And so that's intentional, right? It's creating a space where families can connect with each other, right? We talked about that multi-generational household, that's tight living quarters, but a Family Success Center was able to be that space where you can go and you can decompress and you can breathe. That has changed. But the energy and the service delivery, they're doing well-being check-ins now. They're calling families, they're making sure that they're okay. They're doing calendars, right? So they always had calendar of activities for families so that they can strengthen their family bondings, parent and child engagement, and also broadening social networks so that families can connect with their neighbors. And so they've turned that around since COVID-19 this past month. They've done things online. They've used social media. They've done live video posts. And what we find was so unique and interesting is their collaborations, not only with other programs, right? I know in Elizabeth, the Family Success Center and the School-Based Youth Service Program, they collaborated to announce that they were having a virtual spring break. They provided a virtual college campus tours and also tutoring sessions for students. So if you go back to the previous two slides, there's an example of a Family Success Center calendar there, and everything that they're doing, yes, that's perfect. All of these activities on the calendar are for free. They're for anyone, yourself, myself, people on this webinar who are talking. You can go there for free and you can take part in it. What we also are noticing is that they're still tapping into their volunteers. They're activating people to get involved and to help. So people are posting videos to keep in touch with each other, right? You hear a lot of those hashtags, separate but connected. And so Family Success Center volunteers are very engaged, and they're making sure that they're checking in on each other, their neighbors. They're doing deliveries for their neighbors. If we go to the next slide, this is another virtual activity that they're doing. Right now, census is going on, and the Family Success Centers are pushing that heavily because more than any time, it's important that we make sure everyone is counted for. And so this image, if you go and Google some of the Family Success Centers, they have Facebook pages and they're posting all of their videos and activities. This right here is a census trivia. So they're engaging with their families online, use of social media, to talk about, you know, why census is important and how you can complete that. They're even doing on the phone calls on how to complete it, you know, through video or on the phone, or you can actually do it in person. And they're doing the how-to recordings for their families. Next slide. My last slide, and I promise you, you do not have to squint your eyes. I'll make sure that AC&J can send this out to all of the viewers. The wording is very tiny, but this is our one-pager for the division, and it captures all of the programs that you'll hear about or you didn't hear about. And there's a link in the upper left-hand corner where you can go to see the locations and the contact information for all of these programs that I talked about. Whether, no matter what county you're in, you can find your local program for you. Again, this was an honor. That's all I had to say about my programs. And I think most importantly, practice self-compassion with each other. You know, in order for us to take care of our families and to take care of our neighbors, the first step is taking care of each other. So make sure to give yourself a breather and the space to calm down. Thank you so much.
Good afternoon. I'm Lenore Scott, the Administrator of Early Childhood Services at the Department of Children and Families. I am so excited to be here and a participant in this very, very important discussion. I oversee several state and federal initiatives that include home visitation, central intake, our parent linking program, which works with our teens in the schools. They're our teen pregnant parents, as well as teens who may have small children. I also oversee the preschool development grant Birth to 5, which is a collaboration with 4 other state departments, as well as our adolescent pregnancy prevention initiative. All of the initiatives I oversee are to ensure that the services and supports reach families early and prevent child maltreatment. As I begin the discussion about our prevention services, I wanted to begin with our central intake hubs. New Jersey has a statewide network of central intake hubs in all 21 counties of our state. The goal of Central Intake is easy access for families to needed resources and information that promote child and family wellness through a single point of entry. And as we are thinking, as we all are listening to this important discussion and recognizing the stress that a lot of families are enduring, I think this really becomes an important aspect at this time, right? I think it's hard to, to refer families to multiple services at one time and then expect them to sort of navigate through that web of trying to figure out what makes sense for them. The central intake process is dedicated to helping people find the necessary service by gathering a brief screen from the family regarding their needs and strengths, as well as the information necessary for the referral. This enables central intake to refer families to the most appropriate service based on the needs of the family, as well as the availability and requirements of that service. The range of services in the local hubs include prenatal care, family planning, nutrition services, WIC, home visiting, family success centers, behavioral health, domestic violence support, public assistance services, as well as many, many, many more. The primary focus of central intake is to facilitate linkages from pregnancy to age 5. However, all of the county sites will assist families and individuals with needed connections across the lifespan. The central intake services are a collaboration between our department, the Department of Children and Families, as well as with the Department of Health. Next slide. The central intake hub and local providers, they meet quarterly to ascertain challenges, successes, and review processes. The meeting is attended by central intake specialists, early childhood specialists, community health workers, our home visitors, doulas, and other hub partners. The most recent meeting had close to 80 participants that met virtually. And the focus of the meeting was centered on COVID-19 and how do we support our families during this critical time. There were presentations from state and local providers that was given that included information about the WIC program, Department of Labor, SNAP Ed, our Division of Women presented as well. The presenters provided resources for our families and educated the group on any adaptations or expansions to their services, particularly in the response to COVID-19. I think one of the things that was really, really emphasized that all of these services were open, they're still operating, and we really wanted to make sure, since the Central Intake Hub is that first initial contact, how to make sure that they're getting that word out as well. The local hubs are doing their best to stay up to date on resources during this pandemic. And I think one of the, at the last quarterly meeting, they had the opportunity to ask questions of those providers, as well as making sure that they were up to date on requirements. Had anything changed? I think with WIC, one of the things that came out of that conversation was that they were doing virtual enrollments. And I think that was important information for all of our providers. Next slide. Again, as Janera stated, this slide is really, it's a listing of all of the local hubs at all of the managing agencies, and most importantly, the phone number to reach out for information and referral. We can make this handout available later, but I wanted to include it in this slide since you will have access to the presentation as well. Next slide. The next prevention service I want to discuss is our home visitation services. The overall mission of home visiting is to improve the physical and emotional well-being of infants, children, and their families by providing community-based education and in-home support to families. The eligibility criteria for our evidence-based home visiting services, they vary by model, but typically all of the programs begin working with families during pregnancy and continue until the child is age 2 or 3, and with our one HIPPY program up to age 5. Home visitors provide pregnant women and new parents with health information, parenting education, and linkages to other resources that support children and family well-being. Our DCF-funded evidence-based models include 3 models that are in all 21 counties of the state, and that's our Healthy Families, our Nurse Family Partnership, and our Parents as Teachers. We have one evidence-based model in Bergen County, and that's our home instruction for parents of preschool youngsters, as we lovingly call our HIPPY program. All of the home visiting models have the same goal, which is to promote strong and nurturing parent-child relationships so that babies and young children grow up healthy, safe, and ready to learn. Next slide. So during this pandemic, all of the home visiting programs are continuing to operate under guidance put forth by each of the national models. All of the programs are providing virtual home visits until it is safe to resume in-person visits. All programs are continuing to accept referrals through our central intake hub, and all of our programs are permitted through the national model guidance that they receive to facilitate enrollments, continuing to hire staff to support families within their service area. Next slide. As stated before, all of our home visitors are continuing to meet with families. Some of them are using FaceTime, they're using telehealth, a variety of virtual different platforms such as Zoom or Skype. In most instances, the telephone is readily available for all of our, between our families and our home visitors. The home visitors are demonstrating a resourcefulness and a creativity that goes beyond. I think when we hear the different stories, it just makes you realize, you know, like when you hear the saying that we're all in this together, they are clearly demonstrating that. One of the examples, I mean, there's so many, and you'll hear more from the next speaker as well. That I think one of the ones that I loved the most was that one of the home visitors, she was being very creative. She had a virtual visit with her families, and they were doing, creating these do-it-yourself, no-sewing face masks, right? And so to see the creativity that was exhibited, not only for the home visitor to really think of that and recognizing how needed it is during this time, but then also seeing, you know, having the families work together with their child to be able to create something that is useful for all. So next slide. Many of our home visitors keep their cars loaded with diapers, wipes, formula, baby supplies, so they can drop off to families when needed, and they're, you know, and they're ready. So in this picture, you see the home visitor. She dropped off needed supplies to this family. She called while, you know, while she was still outside, and utilized social distancing and provided the needed help. There are so many more wonderful stories of our home visiting network helping families and staying safe. And again, the next presenter will give you a few more examples of that. And thank you very much.
So I'm Gina Hernandez. I'm the Senior Vice President of Prevent Child Abuse New Jersey, also the Senior Vice President of the Child Wellness Institute of New Jersey. I'm a therapist and I am a parent of 4. So we really are all in this together, so to speak. And thank you so much, ACNJ and DCF, for, you know, putting this together and for inviting me. So I'll just launch right into it. Prevent Child Abuse New Jersey and the Child Wellness Institute, which is a subsidiary, we are nonprofits, and just like our mission says, every program that we have that serves over 55,000 children a year is really focused on prevention. That's our mission. That's what we do. And so for today's purpose, I'm going to share with you some photos, some illustration of how we're staying connected. You want to go to the next slide. We will start off by talking about ways that we're getting connected with each other. And I'm probably going to say it 100 million times, but in this time more than ever, connections matter. We have a host of programs, right? We have home visiting, we have human trafficking prevention. We actually have a program called Connections Matter for this very purpose. It's so relevant. We talked earlier today and Lenora presented on central intake. And so wanted to start off by talking about some of the successes our programs have had. You may already be familiar with it. And then later on in the presentation, I know I only have 10 minutes, so I'm going to fly, but really some tips for parents as you're checking in with them or with your own family in your own lives. Hopefully you can take something away from this in the spirit of all of us being connected and trying to work together on this. We oversee one of the central intakes in Essex County, and we actually moved our developmental screening for children and babies is online, which is very convenient during this time. So you don't have to do the old paper and pencil, really. You can send it to a parent through a portal. And since COVID-19, we have had parents doing the developmental screening online and when there is a concern, being connected directly to early intervention. So services have not stopped. We've just had to get more creative. We even moved one of our meetings to an online platform, had more than 45 people, 7 parents. And first and foremost, we talk about our feelings and our concerns. Let's kind of check in right at the beginning of meetings to see how are we doing genuinely. And then we had a local doctor, and you can imagine how that went. We had a Q&A session where people really were able to ask about the coronavirus, and that is really helpful, especially in live time when you can talk to a medical professional and ask any of the questions you might have that are really sitting in your mind and really in your body as we're all experiencing this stress. And so in terms of central intakes throughout the state, everyone has continued the work, and even more so through this time, to stay connected to families. If you go on to the next slide, this is where I love photos. This is one of our home visiting programs, Healthy Families, up in Sussex County. There is a home visiting program in every county in New Jersey, and several to choose from. And obviously, this is one of our home visitors who is making a delivery. If you go on to the next slide, you can see that prior to the mask requirement, our home visitor on the right, and these are our home visitors in Union County, Parents as Teachers. You can see she's wearing her hand sanitizer from Parents as Teachers around her neck, and making deliveries, delivering concrete goods and things that they need, as well as diapers, which we'll share with you how we have worked to try to meet that need. All of the programs operate with the idea of prevention, right? And so for that to be successful, we all have the protective factors kind of underneath us. So if you think about the protective factors, and I'm just using this slide as an example, social connection, that's one of them. So this is a time we need to be making sure we're connecting families to each other, to do online platforms, but also concrete support in times of need is one of the protective factors. And we know that if you can increase the protective factors, it can really help in terms of preventing child abuse and neglect. So that's what we do, right? We try to offer concrete support in times of need, and what other than now is a time of need. If you go on to the next slide, you will see, okay, we can't go in person, so now we're online. This was a virtual mommy party, which was awesome. And if you look, you can see our little joys. So babies, children, mothers, fathers, everyone was included. And we are still able to do child development and promote parental resilience and parent-child interaction. And we're able to kind of still do that. And it's really nice to see that all of our sites, Healthy Families, Parents as Teachers, as well as I'm sure Nurse Family Partnership and HIPPY, getting creative and making it happen. And so we are connected. We have eyes and ears. We're listening. We're staying in tune with families. If you go on to the next slide. This was what Lenore was talking about. This is down in Cape May. They have do-it-yourself masks, and our little sweethearts there wearing their masks that they need at home. And so we're getting creative. It was done virtually, and it was successful. On to the next slide. Here we are at a holiday, and you can see that in Cape May, the Healthy Families program, they were hard at work, still trying to keep some of the traditions that families find important in mind, and that maybe it looks a little bit different, but we're still preserving those connections and preserving those traditions. So this was one example. They wanted me to tell you they were 6 feet apart on the right over here and on the left, just so you know social distancing was occurring. On to the next slide. These are voices of families to share that they're really, really grateful that despite this situation, and the family on the left actually had just given birth in the middle of the COVID-19 pandemic, and was so grateful that the home visiting programs were still able to connect and provide support during this tough time. So if you go on to the next slide, you'll see that we have a teen parenting program as well, and it's called the Parent Linking Program throughout New Jersey. Notice the pinwheel. The pinwheel is for prevention, and so we distributed pinwheels like we normally do. The only difference was that we are wearing masks, and we did drop off diapers as well. So the teen parents are getting the support as well during this time. If you go to the next slide. This has been a really, really important piece of our work at Prevent Child Abuse New Jersey. We have a New Jersey diaper network, and so far we've distributed about 9,000 diapers throughout the state. You can see the group on the bottom, they have the diapers behind, and they also receive the Period of Purple Crying program, which is a shaking baby syndrome abusive head trauma prevention program, which is still going on in hospitals throughout the state, 16 hospitals. And so, the point is we're still doing it. We're just doing it in a different way. And we do have diapers going out over the next few weeks. And we're set to probably exceed about 25 to 30,000 diapers over the next few weeks. This is a privately funded network. So we do get donations from the people throughout the state, throughout the country to support families that are in need. And now is really, really a heightened time for that. But again, providing concrete supports in this time of need. On to the next slide. This is where things get, get interesting, because a lot of our work is working directly with families and having them understand and having us understand what is happening during this time. A lot is happening. A lot is happening with ourselves, inside of ourselves, with our brains, first and foremost. And many of us are operating in a place of survival. Even those who feel like, well, normally I have it together, sort of. Now things are kind of all over the place. We're in an uncharted territory. So here's what I say with parents. And here's what we kind of share is that at some point or another, right, we're going to go into the red brain, which is our stressed out, I can't really think, I'm overwhelmed right now brain. And what are some ways to be able to get into our green brain, which is our kind of relaxation, rest, and digest brain? And when we talk to parents, we say, you know what? We're not always in our green brain. We can't be. It's not human. We're human. So I think it's really important when we're talking about the stress that we're under right now to normalize it in some way and to find some ways to check in with ourselves first. You cannot calm another person down. You cannot calm a child down when you are red. So if you have a child in red and you're in red, it's not possible, right? Screaming, you need to calm down, is not really going to calm anyone down, right? So that's first and foremost, is when you're checking in with families and parents, where are you at right now? Where's your brain at right now? And also checking in with yourself. So if you go on to the next slide, you can see that we say connect with yourself first. Check in with your pulse, check in with yourself. So when I'm even interacting with my own children, I can sense when I'm getting a little bit testy, right? I'm kind of moving into the red. What do I need to do? Well, we're getting barraged. I mean, literally every minute of every day, it's like, press conferences and information. It's a lot. And a lot of it is negative. And it's adding on to the already existing stress that we have. So connect with yourself before anything else, as a parent, but as a professional too, to check in with how are you kind of going to bring yourself down so that you can be at a place where you can support others. So that's the first thing I'd say. The second thing, as we're talking about connection, if you go on to the next slide, is how we've been doing it. I mean, I don't have to tell you because you're on a Zoom call right now. This is how people are connecting. People are having family dinners via Zoom or via FaceTime. People are getting creative. We're bringing back letter writing, right? So those are some of the creative ways people have been able to stay connected with their neighbors and with each other. And these are kind of tips that we share with parents to be able to kind of give them something to do to still stay connected with each other when you can't actually physically be in the same space. On the next slide, you will see creative ways people have been connecting with friends. Like I mentioned before, people can, safely do this within a distance. I included a picture. I've seen a lot of these parades. It's somebody's having a birthday party, but you can't really have a party. So a bunch of cars go by at the same time and honk. And so that's just a unique way that people are trying their best to stay connected. Because remember, connections really do matter. If you go on to the next slide, people often ask, how do we kind of check in with folks, with family members or with families I'm working with? We tend to do like, so how are things going, right? Or are you good, right? And it's kind of like some of the things I think could maybe dig a little bit deeper if you are really interested in reflecting with a family. And I actually did this with my best friend earlier today. I was like, how has the stress level kind of been in your home Our winter times, they're kind of higher stress. And we shared that when you're trying to, do schoolwork with your children, and I have 4, that tends to be a time that's like this, right? And I'm going into the red. And then how have you been managing the stress? What do you do to manage that stress? So these are just some different kinds of check-in questions. On any given day, folks, if you look down at the emojis at the bottom, on any given day, you could probably feel all of these emotions, right? You could wake up feeling one way, and throughout the day, you're laughing at something funny, but then you're crying because this is just really, really, really sad. And there's a lot of sadness going on. And normalizing that all of these feelings, that is okay, because we're human and we're going through something. But ending the conversation with, what's something positive you've learned about yourself through this? Because that's what we're doing, right? We're looking right now at our programs and we're saying, what's something positive we've actually learned about our programs, about our staff, about those people who are going out on the front lines, and about our families? What have you learned about yourself, and what have you seen within yourself to be strong and resilient? And so those are some of kind of the questions that you're able to use with families if it's helpful to you at all. On to the next slide. If you're interested in a resource guide, Prevent Child Abuse New Jersey has this on our website. The web link is listed on the left, and it will be available by Monday in Spanish as well. So check us out if that's helpful for any parent or caregiver that you're connected to. On to the next slide. And so these are just resources on the Child Wellness Institute, ways to calm our kids, red brain, green brain, and how do you breathe through it? And so these are some examples, free to anyone. So log on, download them, send them to families. On to the next slide. Social emotional learning. Remember, that's part of protective factors, helping families understand that all behaviors that a child is exhibiting, as well as us, has a meaning and is coming from someplace. And on to the next slide. There are so many things on there. This one is one Child Wellness Institute is doing for kids every Wednesday, but there's so many ways to stay connected to each other remotely. And so this was one example. On to the next slide. That's all I got. Thank you so much for this opportunity for us to all kind of work together and talk about ways that we're still doing prevention, maybe in a different way. But the bottom line is those connections, those relationships are really, really valuable. They were there before, and I feel like even more so now than ever, they're really, really critical in being able to help each other through this. So thank you so much for your time.
Well, thank you, everyone. And I'm going to ask Gina, Lenore, and Janira to stay on because we did get a number of questions that I'd like to pose to you. First, I'm sure there's a way to do this, but I certainly haven't figured it out yet. To have all the participants clap, because I think this was an amazing presentation. Thank you. I think it's answered a number of questions we continue to get from families, and it is also, to me, the beginning of a conversation and more to explore. So let me thank you on behalf of the over 300 people who participated in this webinar. I think certainly met a need that's out there. So let me get to the questions. First one is the easiest one. Yes, we have recorded this webinar and we will be distributing it to those of you who you had to register for this, who registered, but we'll also be making it available on our website. This is the 4th webinar we've done. The first 3 looked at issues for childcare providers, mostly around unemployment, the unemployment fund, family leave. This is the first we've done with this kind of a theme, but we have made all of them available, and we also summarize the information that was shared at the end. So you'll have access to the PowerPoints, and we'll do a frequently asked questions of the issues that came up with some of the resource pages that were handed out. So that will all be available. So let me get to the questions. One, I think, is a general question for Lenore. How many new families have been connected through central intake since the COVID crisis started? Do we have any idea?
I don't have any idea at this point, but that is something I can get that information and either forward it, in an email to you or to the particular interest person. I don't want to take a random guess, but I could, I definitely can get that information.
Terrific, thank you. We can get it on. This question came early on, I think, Janira, for you. Do the Family Success Centers have written guidance on some of the changes to the programs in light of COVID-19?
So I wasn't able to mention in the presentation is that there is a network of 57 success centers, but each site is very unique to the community that it serves. So you can go somewhere up north in Bergen County and it could look very different, and you can go somewhere in Trenton and the site will look very different. So no, I think DCF, we work to respect that uniqueness, the unique characteristics of each community and site. So no, we do not have like a blanket document of like, this is how you should modify your service delivery. And I think in this past month, our office and DCF, the department as a whole, has been learning a lot from our family success centers and the communities about what's going on and how are they providing services during this unique and challenging time. But standard, what you'll find is, there's linkages to resources. There's your typical family bonding activities, the parent-child engagement activities, the community engagement activities, right? Because we want to expand the social networks that we all have and connecting neighbors to neighbors. There's the financial empowerment classes or offerings that happen, right? Because we're not just here to bring people together to feel good, but we want to kind of uplift them out of poverty so that they can live stronger lives. There's parenting classes to help nurture those skills. And also there's a host of different things, but again, it's important that you go to the DCF website. We're also going to share the link. If you go on our website and you go into the Family and Community Partnerships webpage, you'll be able to access the program directory, and you can find out their contact information. There's web pages and also Facebook pages where they have their calendar of activities. So you're able to see what they have and see how unique each center is.
Great.
That was a long-winded answer.
Thank you. I think that's very helpful. And again, I think the commissioner talked about the resource that the DCF website has as well. Janira, one last question about the Family Success Centers. Are there any particular needs that the Family Success Centers have?
So I guess my question, are you saying needs for the staff or needs that they're identifying in their communities?
I think needs that they're identifying in their communities. Is there a way of monitoring that?
Great question. We are actually, it's so beautiful. The commissioner she's scheduled these calls with all of her providers. And so she does these more intimate calls where she's touching base with all of the Family Success Center directors or school-based directors to learn about how they're working and what the needs are. In addition to that, my program leads in my office, they oversee the contracts. And so they work closely with those Family Success Center directors. And so they're constantly touching base and doing our version of a wellness check-in for the directors to see what's happening on the ground and how can we bring these inquiries or questions back to the department leadership. And so what we're learning is there's a digital divide. Some school districts were able to give out Chromebooks and hotspots for families, but there are some areas where children are doing homework on a smartphone.
Right.
Right? There are families who are very scared, right? The resources are there in the community, but they're scared to go out, right? And I guess it speaks to the question about, are there services for undocumented families? Yeah. Yes, there is at the Family Success Center, right? They're building trust with communities that are vulnerable and very scared to actually go out and seek what they're entitled to have. So, they're actually seeing that there's families that are scared. There are families that I mentioned earlier about the multi-generational families where you're living in these tight spaces, but you're trying to help families recover from COVID-19, and it's hard to practice social distancing. So that's another concern that's coming up as well.
Great, thank you. And I think with your contact information, I'm sure there'll be follow-up with all of you. There was a whole set of questions that came in specific to services. One do counties have, is there information available by county for some of the services you described? You talked about drop-off groceries, the diaper network. Is there any way that someone can get access to what's available in their particular county? And I think that's for anyone, Lenore, Janira, Gina.
Hi, this is Lenore. I think one of the ways that I mentioned earlier is to actually reach out to the local central intake hubs. And that information, it was available in one of the slides. And again, we can make it available in a handout. I think that on our DCF website, we also have our prevention services listed by county. So I think that's a valuable resource for folks as well. So I think things are changing constantly as we're doing this work. And so I think those may be two great starts to be able to find out some of that information.
Okay, great. And I know, as I said, we'll distribute the information that was provided in the slides or discussed during the conversation. A question related to that, but a little more specific. How can I refer a family to central intake? How does that referral get made?
So on that list, they could actually make a call to them. A family can refer themselves. They can, if it's a provider or a family member or anybody, they can call and refer to the local hubs in, their county. And so that's the process because one, we wanted to make it as less arduous as possible. So I think that's the quickest way. The easiest way is to call that local number, and folks are available. They are all working virtually to address, families at this time.
Okay, so we'll get that information out.
Mm-hmm.
And then a question came up that wasn't specific to this discussion, but it was about where someone could obtain screening services for preschoolers. I'm not sure that's an issue for central intake or we can follow up on that question and get back to the individual who raised it. I think that covers the questions that came up. Janira, you anticipated the questions about serving undocumented families. Thank you, that was great. I see Commissioner Byers' name. Does that mean that you're back on the call?
Here. Oh, I've been here the whole time. I have to hear how well that everyone's presenting on all the excellent services that are available to families during this time. And I actually I didn't want to interrupt as they were sharing and answering, but one of the things I would like to say is, those calls, the provider calls that I've been doing really have been very valuable in being able to hear directly about what the needs of families are around the state and how families are accessing services for themselves, with schools not being in session or maybe not having contact to school counselors and teachers, not being able to just go walk into a family success center or being able to, feel that there's someone, can't even walk next door to your neighbor's house maybe. And so there are a lot of families that are managing very well. There are others who are struggling to manage their household and just the stressors that they're now facing. One of the things we're researching currently and have reached out to a partner to help us in kind of doing surveying direct phone calls to families to say, not only what are your needs during this time, but, how are you accessing services that you need, or who is your person that is, helping you cope or connecting you with the supports that you need. And I think the reason we're looking to do that is because we want to, as the department, be as helpful as we can in further supporting those providers or those resources that are local, that are, in the counties, where families are feeling very connected to. At this time, people are reaching out to who they know or what they know. And so it's just another valuable piece of information for us to think about, in prevention services and spreading those. How do we identify, what are the natural supports for families?
Great. Thank you. Well, we have reached our time. So let me wrap up by thanking all of you for, I think, what has been a very informative and engaging webinar. Lots of information, but I'm sure a lot of opportunity for follow-up. I think, Commissioner Beyer, I just want to commend you for your efforts to focus on how we can support families during this crisis. I listened to you a couple of weeks ago when you spoke at Governor Murphy's press event, and you said something that stuck with me, which is that self-distancing does not have to be self-isolation, and that there are things that we can do formally through the programs that were discussed today, and informally through the strategies that were described that we can all do as individuals. So thank you for your leadership on this. Thank you all. It was wonderful to hear your presentations, a ton of information. And again, to those of you who participated, thank you for your interest and your questions. And we'll make sure that this recording and the materials get to you after this. You have to give us a little time, but after this. And thank you for joining us today.